But thank you again, Anissa, for doing this. We are happy to have Analisa Packham of Vanderbilt University. Her work covers applied macroeconomics more generally, but specifically labor economics, health economics, and also the economic education. She's also a research fellow at the NBR. We're going to go for like 60 minutes and then leave 15 minutes for Q&A at the end. Thank you. Go ahead.
Okay, thank you so much, Salem. I really appreciate you guys having me here today. And I'm even more excited to present new work with Alexander A. Hammer. He is an assistant professor at Johannes Kepler University in Linz, Austria. And the big question that we really want to think about here today is how does unemployment insurance, and more specifically, how does unemployment insurance duration affect health and risky behavior? And so feel free, we're going through, I mentioned I have my chat open if you want to type in there, or it doesn't bother me in the slightest if you guys unmute and just say that you have a question. I'm happy to take them as we go along. Okay, so let's think about why unemployment insurance duration might actually matter for a few outcomes that I think economists and other social scientists and policymakers really care about. So for example, there's been a body of work showing that unemployment insurance duration is related to unemployment duration. More so, we call this moral hazard effects in economics, that as unemployment insurance duration increases, people take longer on unemployment insurance benefits, they spend longer looking for a job. And while those moral hazard effects might have costs, they also might have benefits if it leads to individuals finding a higher paying job or a job that has what we call a better match. So something that uses their skills more, that they're more productive in, and that they end up having higher wages. Now, at the same time, lengthening unemployment insurance might have effects on mental and physical health for a number of reasons. For mental health reasons, we can imagine that just the shock of unemployment itself can be very stressful. It can lead folks into depression or anxiety. And so by allowing them a longer time to look for jobs without experiencing a huge negative income shock can alleviate some of that stress and anxiety. And at the same time, physical health or mortality might be tied to unemployment insurance duration if we think that by mitigating some of this large negative income shock, people are able to invest more in their health. Of course, in the US, this matters as well, because we know that as people lose their jobs, typically their insurance is tied to their jobs, and so that can also affect investments in their physical health. So this paper is going to think about how does UI benefit duration affect health and risky behavior. We're going to be thinking about this from a perspective of extending UI benefit duration by 9 weeks. And in particular, we're going to be analyzing the effects of this UI duration on hospitalization, on prescriptions, and disability claims for Upper Austrian workers. And we're going to be able to link that to their children as well. And if you're like, well, why are you studying Austria? Number one is that Austria is going to give us a nice policy environment in which to look at an exogenous shock in benefit duration. It's also going to allow us some very rich data that we can link for workers and their health outcomes. So we're going to be able to look at the universe of Upper Austrian workers, their health outcomes in terms of prescriptions, hospitalizations, and disability claims, and we're able to link within households so we can observe workers who are laid off and their children's health outcomes as well. This is also going to be nice for us because this is a setting where workers do not lose their health insurance while they're unemployed. So any health effects that we're seeing here are in this context of a setting where individuals are in a relatively generous safety net. So any effects we find are in spite of the safety net and in spite of universal healthcare coverage. And we also argue that even though this isn't, a US-centric paper, that this does speak to a large number of other countries, especially other countries with universal healthcare, and at a time when a lot of other countries are also considering things like extending UI generosity, extending UI benefit duration during the current pandemic. So what we're going to do is we're going to exploit this policy that extends UI benefits in Austria for workers that are over the age of 40. And in particular, what we're saying here is that if you're unemployed at age 39, if the firm lays you off, you are only eligible for 30 weeks of unemployment insurance benefits. If the firm decides to lay you off when you're 40, 41, or 42, et cetera, then you get an additional 9 weeks of UI benefit eligibility. I'm going to talk a little bit about whether individuals end up taking up this additional 9 weeks, but for now we can just think of it as the possibility of spending an additional 9 weeks searching for the best next job that you possibly can. We're not the first to exploit this policy variation. We're actually building on an AER paper by Napoy and Weber from 2017, and what they do is they just show that UI duration leads to longer unemployment. They also are looking at job match. So they find that this policy that extends UI benefit duration by 9 weeks does lead individuals to find higher paying jobs. And it does lead them to spend a longer time looking for jobs. So we're also going to be able to replicate those findings. We do see increases in wages, and we do see an increase in time spent searching for that next job. But what's important here is those average effects we find are actually masking really important heterogeneity by gender. So in particular, we're going to find that that wage increase is coming directly from female workers who are unemployed at after the age of 40. And we're also going to be able to expand on this work by showing these effects for mental and physical health for workers and their children. And I think this is really important and a big contribution to this literature because often omitted from these papers are effects on women and children. In general, a lot of papers focus on things like mass layoffs or plant closures or large macroeconomic shocks, and they tend to focus on effects just for male workers. Here, we're going to be able to say something a little bit about the household as well as the differences between giving an extension to male and female workers. And so we think that that's going to have a lot of potential policy implications. So just to give you a preview of where we're going today, in general, we find that extending UI benefits by 9 weeks does lead to a longer time spent unemployed. So we see an increase in benefit duration for all workers, but that this variation does depend on gender. So in particular, female workers spend about 4 times longer than male workers on unemployment insurance after, sorry, I just see Dennis that says, is anyone having audio problems? Before I continue, are we okay?
I can hear.
Can you guys hear me?
Yes. I can hear.
Okay.
I can hear you.
Okay. Okay, good. Great.
Fine.
Okay, thank you. So we see that female workers spend about 4 times longer on unemployment insurance benefits when they're eligible for that additional 9 weeks. And importantly, I want to make the distinction here that what we're going to compare throughout is not just females to males, but in particular, our identification here is going to look at female workers compared to other female workers for our discontinuity estimates and males compared to other males. Oops. Effects are also going to differ importantly by gender. So the time spent unemployed does seem to be mirrored by these health differences. And in particular for women, we're going to find that extending UI benefit duration by 9 weeks reduces dependence on opioids, reduces take-up of antidepressant prescriptions, and reduces disability claims. We're also going to find some evidence of positive spillovers on their children in terms of prescription costs and outpatient expenditures for children under the age of 6. So young children do seem to benefit by moms getting an additional 9 weeks of unemployment insurance eligibility. For men, however, we don't see these positive health shocks. If anything, we see an increase in the take-up of heart medication for cholesterol, and we also see an increase of heart attack. And we'll talk a little bit about what mechanisms might be driving this later in the talk. We could think of this potentially being a stress-related event or something related to risky behavior. We see an increase in disability claims for men. That's on the magnitude that almost cancels out this disability claim decrease that we see for women. And when we look at what workers tend to be driving these effects, for both genders, parents seem to be the driving force. We also see low education and low skilled workers and workers in physically demanding or jobs with hardship is what they're called in the data set that seem to have a larger effect on outcomes like opioids. So I think that these findings do have important policy implications. In particular, the relationship between unemployment and opioids is often studied in the US context, thinking about how unemployment could lead to opioid increases. But here, Austria has the highest per capita morphine take-up in the world. And a lot of these opioids that are being prescribed are weaker doses of opioids. So they're not large Oxycontin or hydrocodone pills. They're simply smaller doses that might be actually prescribed to help people get through the workday. So if we think that women are in these difficult or physically demanding jobs that are taking opioids simply to get through the workday, by giving them an additional time to search for a higher paying or better job that is less physically demanding, it's possible that we can reduce some of that dependence on opioids. It also might have important policy implications for where we want to give people either more generous UI benefits or a longer UI duration. In particular, this does seem to suggest that female workers might benefit strongly from having an extension in UI benefits. Now, you might be thinking, okay, well, I'm not sure if I believe this because I don't know why UI would be a positive shock for women, but not a positive shock for men. It seems giving individuals an additional 9 weeks to search for a job should be maybe positive for both genders. And so we're going to think through the mechanisms here. One possibility is that maybe women are quote unquote overworked. So it's possible that women are simply just doing longer hours. We know that the labor force participation rate in Austria and in many other OECD countries has reached an all-time high. We also know that despite the fact that more women are working full-time jobs than ever before, they still report doing more responsibilities at home in terms of childcare and taking care of the home. So it's also possible that by extending these benefits by 9 weeks, you allow some of the constraints on a woman's time or female workers' time to kind of relax a little bit. They're able to reduce dependence on opioids that they might be taking to get through the day. They're reducing their dependence on antidepressants because in general, they aren't as stressed out potentially. Another way to think through this is, okay, well, maybe women are matching to a higher paying job. That's changing their trajectory. That's making it so that they don't have as much physical demands on the job. They just have higher wages. And so as a result, they're not going to decide to go on disability retirement at an earlier age. And so maybe that's what's driving the effect. And in fact, we do find evidence to suggest that women that take longer in finding a new job do see those higher wage gains. And so we think that both of these ideas are going to be plausible mechanisms for what we're seeing for our effect magnitudes. So today,
one question one question I've been wondering about, maybe you're going to get to it more later, is how would this interact with maternal leave policies for women? I don't know what Austria's policies are on that, but it would seem there could be some interaction between unemployment insurance and then women timing that in such a way when they would otherwise be taking maternity leave.
That's a great question, David. If we think that women are just waiting and then they have a baby at age 40 and so then they get the unemployment and they are coupling that with maternity, in general, Austria has more generous maternity leave than the US, but we don't actually see any differential effects or discontinuities on childbearing at that age cutoff. So we don't think that people are choosing to have kids just before or just after the cutoff. Okay, so today as we go through things, I want to present in more detail these estimated effects of UI benefit duration on mental and physical health for workers and their children. If you didn't believe the story I just told you, I would love to hear feedback on potential explanations or other mechanisms, and just kind of thinking about the evidence supporting our hypotheses, whether or not you think that's believable, or kind of what other comments you have or what else we should look at. So I am very excited to hear more feedback as we go through. Oops. Give you a little bit of background on what unemployment insurance looks like in Austria. This is a compulsory insurance with a 6% payroll tax. Similar to the US, applicants must be willing to say that they'll accept reasonable employment or undergo some job training as a result of being on UI. And the benefits formula is calculated relative to previous after-tax earnings. And in general, the benefits replacement rate is about 55% and can be up to 80% for low-income families with children. So it is a more generous program than the US, but not a replacement rate of, say, 100%. This UI duration is based on age and experience. So for example, this experience criterion that we're going to use here says that you must have worked at least 3 out of the 5 years to get 30 weeks of unemployment benefits. But then as soon as you hit age 40, there's a criterion that says if you have worked more than 6 out of the last 10 years, you are eligible for an additional 9 weeks of benefits at that age cutoff. There's an additional age cutoff here that we're kind of going to abstain from, and it's that above age 50, you get a year of benefits if you've worked more than 9 out of the last 15 years. In general, this age 40 cutoff is going to be one that's a little more important for our context because you do see this to be a little more binding than that age 50 cutoff. So what we're going to do here is we're going to cut the data and we're going to only look at workers unemployed between age 30 and age 50 to, again, avoid any kind of confounding factors from that second cutoff. Importantly, there's no incentive for firms to hire or fire around these cutoffs. So it's not an experience-related UI like we have in the US. So there's no real issue with a firm hiring or firing someone just over that age 40 cutoff. And I'll show you some empirical evidence to suggest that they're also not doing this. Also, cost of health insurance, just to remind you guys, this is a universal healthcare coverage, so it's not going to change an individual's propensity to go to the doctor or be hospitalized. So the data we're using here is the universe of unemployment spells in Upper Austria. It's just a portion of the top of the North Austria that has the biggest city there is Linz, Austria. We have 11 years of data spanning 2003 to 2013. And we're going to be able to say something about the age, gender, migrant status, residence, and unemployment date. So of course, importantly, the age is going to be really critical for our analysis here, as we're going to be thinking about that age 40 cutoff and comparing male workers just to the right and to the left and female workers just to the right and left of that cutoff. Again, we're only going to be looking at individuals who meet the experience criterion and that are aged 30 through 50. And we're going to do some placebo checks to show you that that experience criterion, if you take that away, meaning that an individual is not eligible for the additional 9 weeks, our effects are essentially 0. So we're going to be able to link this individual level administration data to health outcomes as well using the Upper Austrian Health Insurance Fund and Austrian Social Security database. This is going to give us prescription data, so we know the names and doses of every medication they're getting. It's going to allow us to look at things like opioids, antidepressants, benzodiazepines, and heart medication. We're also going to be able to look at hospitalization. We know something about whether or not they visit a doctor, and we're able to look at disability claims as well. And so I'll talk a little bit about disability. In Austria, it works a little bit differently than the US. It's essentially something that you can use for in place of retirement. And we're going to be able to link to an individual worker's children here as well. So importantly, I wanted to say that the average duration of unemployment is only 75 days. If you do the math in your head really quickly, that's obviously much lower than 39 weeks of unemployment insurance. So I wanted to highlight here that it's not necessarily true that these individuals are taking the additional 9 weeks. Some of them certainly are to search for a new job, but really we're thinking here about the treatment being the opportunity or the option or the eligibility of having that additional 9 weeks kind of in your back pocket if you still haven't found a job after 30 weeks. These effects in a kind of a causal setting, we're going to use a regression discontinuity approach. So essentially, we're going to be just thinking about whether or not the worker is just to the left or just to the right of that age 40 cutoff. And we're going to control for month-year fixed effects. Obviously, since we have 11 years of data, we don't think that a worker that's laid off in 2009, for example, might be exactly the same as a worker that's laid off in January 2012. So we're going to control for that time variation. Also going to be able to say something about an individual worker's outcomes that I mentioned earlier. Specifically, we're going to be thinking about prescriptions, cardiac events, days in the hospital. We can also say a little bit about substance abuse treatment. And we're going to collect standard errors at the age bend level. I'm going to with quadratic fits, although the paper does have some robustness checks where we use other things like linear fits. And if you're, okay, well, how do we know what opioid use means? What is the time that you're going to be using? We're really going to focus on that 39 weeks within the job layoff. So we're going to show that these effects span over time as well. So some effects are going to be more persistent than others. We can show, for example, your opioid prescriptions 1 week, 1 month, 1 quarter after layoff, and so on. So we're going to be able to say something about the robustness of those, that the span of time after layoff as well.
I've got a clarifying question, and I think I just missed something. Could you explain more? What is the logic behind the age 40 cutoff? I guess I really missed that. Why is age 40 is the cutoff for getting this extension of benefits?
I don't know intuitively why the law stands other than in general, as you become more established in your career, it might be harder to find a job right away. Or arguably, we want to keep replacing people's income that might be more likely to have a family or more dependent on having a stable income.
Because you're sort of taking this as an exogenous change, right? This sudden shift and setting it at age 40. And I just would have thought there would have been some policy logic behind choosing that age.
So choosing it because that's what the government chooses. So the government chooses to give you an additional 9 weeks of benefits after age 40.
But they didn't, this was a law that went into effect or a policy at some stage. Was there any discussion about why they chose that age? Or? So
this policy has been around for decades. I'm sure there's discussion somewhere as to why it exists. I think the arguments are typically that we want to support families and people tend to be more likely to have a family after age 40. But no, I don't know exactly why 40 was chosen instead of 35 or 45.
Okay. All right. Thank you.
Yeah. So our identification assumption here is going to rely on this idea that no other policy changes or related events occur at the same time. So at age 40, so other determinants of health should be smooth across the age cutoff so that we can say that, look, if I compare a female worker unemployed at age 39 and unemployed and another worker unemployed at age 41, that the only difference between their health outcomes should be the fact that one of these workers is receiving an extension in UI benefit eligibility and one is not. So again, I really want to make this super clear that we're comparing these just ineligible to just eligible. And since we're going to be looking at men and women separately for much of this analysis, I just want to emphasize again that we're just comparing ineligible females to eligible females and ineligible males to eligible males. So even though we can say something about the difference between female and male workers, we're not directly comparing, say, Maria to John. We're just comparing Maria to Elizabeth. So if we look at just the effects for our pooled sample of workers, this is just thinking about the first stage of benefit duration. This is similar to a graph that I showed you guys earlier, but at that age 40 cutoff, it does look like this policy of allowing individuals to take up an additional 9 weeks of benefits does the time that people spend unemployed. Notably, this estimate seems relatively small, right? This is only 2.38 days. We're going to have the discontinuity estimates here in the bottom right corner on these graphs. And so you might be thinking, all right, well, you're giving someone 9 additional weeks. They're only taking up 2 additional days. But I want to emphasize again that this does vary by gender. Women are going to take an additional 4 days to search for a job. And there's going to be significant heterogeneity in how many days individual workers take. In particular, low skill workers are going to take longer to find a job than these higher skill workers. So if you ask yourselves, okay, so they might take longer, they're unemployed, but maybe we don't care so much about the costs of people spending longer on UI if they end up finding a better job. And we actually do find that this is true. In a pooled manner, you see an increase, but this is completely driven by female workers. So in particular, we see this increase in log wage of a new job by women. This accounts for about 350 euros per year. So again, not a huge difference, but for the women that are getting the wage increase, it could make a substantial difference in their career trajectories or just in general, how they're able to support their family. So if we look at, for example, just the quartiles of the number of days that an individual takes to search for a job, what you can see is that in the bottom quartile, some workers take only 1 day to 3 weeks to find a new job. For those women, you do still see an increase in wages, but not for men. For women that spend up to 50 days searching for a job, again, you see that wage increase. And for the longest folks here, you still see some increase, although it becomes statistically insignificant after individuals are searching for a job up to 273 days. What I also want you to take away from this is if you notice, the men that spend a much longer time searching for a job end up having a sharp decrease in their wages. So for what we're going to talk about later, the disability claims in which men are more likely, once they're given this long extension, to claim disability retirement, it might be coming from the fact that for those male workers who spend much longer finding a job and end up not finding a higher paying job, but rather get lower wages, this might be inducing them to spend longer, to retire earlier or claim disability retirement. Okay, so in general, the job search time for women increases by about 9%. Or about 35 days, although we only see the take up in UI benefits for an additional 4 days. So what we find is that there's an increase in job quality for women. This is driven by women in lower skill and physically demanding jobs. We don't see this increase for men as measured by live wages. You might be asking yourselves, okay, but maybe workers are just more likely to be laid off right above that age threshold. And so that might be some selection that's driving the results. I'm going to show you that we don't find any empirical evidence of firms hiring or firing around that cutoff. So it's not just that these workers are systematically different. Similarly, you could be thinking, well, maybe there are other related events or income transfers driving this. So maybe, they chose age 40 because that's when they give some other benefits. Maybe there's some other programs that kick in. So to our knowledge, we've talked to different officials. There are no other policies that turn on at this age cutoff. And in general, we see that covariates are also smooth through the threshold. So we're not seeing that, for example, after age 40, that firms tend to lay off a bunch of migrants or women or anything like that. We're still seeing some pretty similar bend covariates through those thresholds. And you might be asking, well, why should we expect any health effects at all? Because you just told me that at the upper end, women are only spending about 35 additional days searching for a job. They're not using that 9 weeks. And so what I'll say to that is that you're right, most workers are not going to exhaust the full 39 weeks of benefits, but other work using this cutoff does show lasting effects on employment, and it does show lasting effects on wages. So if just by giving an additional time to search, women or female workers in particular are able to take that time to really find a job that has a higher career trajectory or a higher wage, it could end up changing their health status simply by giving them a less stressful, less physically demanding job, or simply by allowing them to find a job that is a better match. We also know that job displacement in Norway, so another European country, did affect cardio health of workers in their early 40s. So for some of the cardiac events we're going to look at for men, it could be the case that even these small effects that we're finding for unemployment insurance are still going to affect things like smoking or cardio health or cholesterol. And so even though we don't see a lot of workers exhausting this additional 9 weeks, I think that this can still inform how maybe small policy changes or targeted transfers can create shifts in a worker's health and well-being. So let's dive a little more into these health and risky behavior effects. So first, we'll start with prescribing behavior. I'll show you some differences for men and women. And again, this is going to be effects within the first 9 months of job loss. But we can also view how these estimates are going to change over time. So I'll show you some 3-week rolling bends to indicate how those effects are changing within those 9 months. And we're going to look at effects on opioids, non-opioid pain medications, antidepressants, and benzodiazepines.
Maybe before you go to those, I have a question. So
Sure.
what percentage of men and women actually use all the 9 additional weeks?
It's rather small. It's only about 2% of workers are going to use their full 39 weeks of benefits.
Anything close to that, like 35 weeks? Because the question would be, maybe there is a group, just thinking there's a group that use maybe not the 39, but something close to that, and the effect is sort of concentrated in that specific group. I'm not sure, but maybe that's one option.
That's right. So we can do more with just thinking about the quartiles of who is using those benefits. So for example, we know that women that use over 100 days of their UI eligibility to search for a new job don't have as large of wage effects, but yeah, we can do more with the health effects to see if it's those that exhaust benefits are driving our effects. In general, we've done that in the past. And if we just look at exhausters, there's such a small proportion of the total population, we don't see huge effects there. But we could do more with the quartiles.
Since I had a question too, since Salem stopped you, and maybe you went over this, and when you went over the logic before, I don't remember. But it was occurring to me that what could be going on is that men are sort of perceive themselves as the main breadwinner in the family, so they feel under more pressure to find employment right away. Whereas if women are viewed as more supplementary earners, they can take longer, and there's sort of less pressure on them, and that could also have differences in health implications for the two things. Maybe you said that before, I don't remember, but it was just that was occurring to me as sort of a difference between the genders.
Yeah, I think that that's a good point. It could be that perhaps male workers feel obligated to find a job faster. And so that's explaining kind of some of the differences there. I will say that even for male workers, we do see an increase in search time just given the eligibility of benefits. So yeah, I mean, I think that some of the health effects for men that we're going to find fit into the story rather well. If you think that in general, giving an individual an additional time to search can weigh heavily on a male worker who is now worried about finding the best job for his family because he feels that as a major psychological role. Okay, so for opioid prescriptions, what we're going to find is that we see opioid prescriptions fall for female workers by about 17%. If you're like, well, it's because you have these 2 points just to the left of the cutoff, that's a result of us binning by 3 months. If we bin by different, say a month, it doesn't seem so stark that this is an increase. So we still see an increase just in the underlying data by about 17%. We don't see any of these effects for male workers, which might indicate that either the male workers are continuing on in a physically demanding job more quickly, or just simply that having this addition in benefits is not going to affect them in the same way. So importantly, I think that this could suggest that female workers in physically demanding jobs might be using opioids to get through the workday. By allowing them to search for a different job, we are also reducing potential dependence on opioid prescriptions. And Kruger has a 2017 report that argues that opioids could be potentially helping workers stay on the job. It's not necessarily true that individuals take opioids just because they're unemployed to have more leisure time. It could be something that's helping individuals get through the workday. So if we ask like, okay, well, what happens to other types of pain prescriptions when we grant female workers an additional 9 weeks of and what we find is that there are also reductions in low potency opioids that you might be more likely to take while you're on the job, again, to get through potentially a physically demanding job. And when we break this down, we do see that this tends to come from female workers that are in jobs that we would consider more physically demanding. Things like factory jobs, construction, jobs that generally are considered those with hardship.
Analisa, can I ask you a question?
Absolutely.
Maria, so you're comparing people that are in their 30s with people that are in their 40s, right? Essentially.
Yes.
So not 39, 41, but could be people in 31 and 49, right?
Yep.
Yeah, and so I think it would be interesting to see the compositions of those groups, right? Because then you see if you compare 39 and 41, then kind of you would say everything might be very similar in terms of health. But if you kind of expand those groups, then like it makes me wonder how similar those groups are in order to compare health characteristics.
Yeah, that's a fair point. So we do some stuff with bandwidth. So we limit our bandwidths a little bit, not be so inclusive of 10 years. So we're not necessarily always comparing 30 and 50-year-olds, but yeah, our average effects are going to pick up. You're absolutely right. Are going to pick up the fact that a 32-year-old is still being compared to a 45-year-old. So that's a fair point. We do have similar effects even when we limit our bandwidth, but yes, the downside of this being an age cutoff is that we know that as we get older, we might need pain medication to get through the day, not necessarily because of changes in the job, but just because of age and things not working as well as we'd want, right? So yeah, that's a good point.
And also, like, I don't know, but maybe I don't know how well, like, probably has been studying the health literature, but I don't know how much opioid dependency varies with age, right? Within females, just with that. And I think it will be also interesting to see singles versus married women there. You probably did it, or you have worked with that, and you will mention it in next. But I thought it was also an interesting point.
No, that is really interesting, Maria. And actually, we can't look at single versus married. So that is one limitation of our data. We know folks that have kids, but and we can link them by birth certificate data, but we don't actually know if someone's married or living with, say, the father of their child. So unfortunately, all we can say is about the workers by themselves. I will say that we did do more placebo checks. So we do look at, for example, workers that don't meet that experience criterion, so they don't get the additional 9 weeks of benefits, and opioid prescription use is smooth through the cutoff. So it does seem like there's something in particular about giving people this additional 9 weeks, and it, again, might be due to the fact that they're just changing the jobs that they have. But yeah, I do wish that we could look at single versus married. I would love to be able to show that to you next, but we can't do it here.
Yeah. Yeah. Also, the fact that if you get older, it might be more difficult to get a job, right? So I think like it's important to reuse that bandwidth. I would say. Yeah, we'll show that more. Yeah. Thanks.
Yeah, that's a good point. Yeah, thanks. We can push on that for sure. Okay, so the other question we wanted to think about is what about substitution effects from opioids to other pain medication? So maybe female workers, for example, are taking pain medication to get through the daily demands of their job. And now that they have this additional time to search for a new job, they're just going to substitute towards different kinds of pain medication. So in general, we don't see an increase in just overall average pain medication take up, but I don't have the graph here. What we do see is a large increase in the 2 to 6 months following unemployment. So essentially in the first quarter or two after a layoff, you see female workers in particular who are eligible for this benefit extension substitute away from opioids and towards things like acetaminophen. So we do see a short-lived increase in acetaminophen and a persistent increase in opioids and all pain medication. We also look at antidepressants because, as I mentioned earlier, unemployment itself can have huge mental health effects given the shocks of losing your income. It could also mean that extending UI benefits could help alleviate some of the stress, and by finding a higher paying job, this could also reduce depression. potentially. So what we see is that antidepressant prescriptions for female workers fall by about 9%. And we don't see this corresponding effect for male workers. So this is going to correspond to about 900 fewer antidepressant prescriptions over the time period that we have. Now, interestingly, what we see with benzodiazepines, which are common prescriptions prescribed for anxiety, is an increase by 25%. And if you're thinking, well, why would allowing individuals to take an additional 9 weeks of UI benefits lead to an increase in anxiety? These effects should be offsetting if we think anxiety and depression are related. I'm going to say that this isn't necessarily the story that we see borne out in the data. In fact, if we break this down by individuals who are in psychotherapy and not, what we see is that increase in benzodiazepine use is for those that are already seeing a psychiatrist. So what we see is that maybe by losing your job and getting that additional extension, you might have this additional pressure, again, to spend 39 weeks searching for the possible job you can. And so for those small numbers of workers that are in therapy, we do see them more likely to be prescribed. But the antidepressant prescription decline is coming from our general sample, those that are not in psychotherapy. Okay. So if we ask ourselves what effects are short-lived, what effects are long-lived, thus far I've only shown you effects just within 9 months of unemployment, but we might care how those effects kind of move across an individual timeline after they're laid off. What we see is that opioid and antidepressant prescription effects are going to persist even up to 18 months later. Whereas for those non-opioid painkillers, as I mentioned earlier, these are going to be more short-lived. So just to recap here, we're going to find that extending UI duration eligibility by 9 weeks, just giving people the option to take that 39 weeks of unemployment insurance, decreases opioid prescriptions, increases, leads to short-term substitution, so less potent pain medication, decreases antidepressant prescriptions, and this is going to be driven completely by female workers. We don't see these prescription effects for male workers. If we turn to thinking about how this also translates into healthcare utilization and hospitalizations, we can think about, for example, effects on inpatient stays, whether or not there are more preventative screenings, whether female workers are more likely to visit a physician or spend money on healthcare, again, potentially driven by the fact that if they have higher paying jobs, now they might invest more in their healthcare and their children's healthcare. Similarly, we might think that if there are large effects like stress or other mental health issues, this could affect things like events. In general, we don't pick up very much in terms of inpatient stays, arguably because this is not a super frequent event. So we don't find any statistically significant effects there. We don't see it for physician visits or healthcare spending either. But what we do find are some effects for healthcare utilization for unemployed workers' children. And specifically, if we link female workers to their children, we're able to look at the kid's age. We see that these are going to be large effects for children under the age of 6, but not for older children. So it could say something about potentially by allowing a female worker to have this additional 9 weeks of unemployment insurance, by allowing them to have find a higher paying job that leads to a different career trajectory, they're able to invest more in their young children's health, whereas the older children might not potentially need as much investment once they reach, say, age 12, 13, 14. Okay, so we do see a decrease in outpatient expenditures and prescription expenditures for those young children by about 30%. So this is relatively large for our children. So if we think about other specific types of hospitalization, as I mentioned earlier, we don't see these overall effects on inpatient stays or doctor's visits. And so again, these average effects, though, might be masking some variation in what types of hospitalizations we would most likely link to being unemployed or to having an addition or an additional 9 weeks of unemployment insurance benefits. So there's some existing evidence that job loss leads to more stress. There's also some evidence that more generous unemployment insurance leads male workers to smoke more. leading to additional problems with heart attacks, strokes, or cholesterol. And so we're going to focus on acute heart conditions here to think about how this additional extension and benefits can affect things like heart attacks and stroke. And so what we see is maybe a slight uptick for females and males, although you see this bigger effect for males, a statistically insignificant increase for females. And in particular, we see an increase in cardiac events for men by about 42%. So this is an additional 700 cardiac events across Upper Austria in a given year. So just to recap again, we find that extended benefit duration eligibility by 9 weeks has some positive health spillovers for children under the age of 6, but no overall average effects for female workers on things like hospitalization and doctor's visits. And we do see an increase in cardiac events for men that is not mirrored by our female workers. I don't have time to show you all of the health outcomes we look at, but I'll say that we do see changes in mortality or childbearing. We do see some increases in total prescriptions for men, but this is driven by increases in heart medication, again, suggesting that that additional 9 weeks of benefits, which we see that for men spending the full search time looking for a new job actually lowers their wages. It could explain why we are seeing these adverse health outcomes for males. And we do look at drug and alcohol substance abuse treatment. In general, we see a decrease in opioid dependence treatment for female workers, but it's not precise enough across specifications for us to really hang our hat on those effects. So we ask now, who is going to be the most impacted by that UI benefit extension? We can do a little bit more to say something about the types of workers who are affected by the policy. So in particular, we find larger effects for part-time, low-income, low-skilled occupation workers, those with children who didn't attend college, and really importantly, I think for our story here, the workers in more physically demanding occupations. So if we look at kind of how those effects compare to our baseline estimate of 0.002, what we see for female workers is that parents are more likely to have a decrease in opioid prescriptions, about 4 times more than our baseline estimate. Again, low skilled occupations, we see this decrease in opioid prescriptions for female workers. Large coefficient here for our jobs with hardship, which again, those folks might be relying on opioids to get through their day, and low education. So I see a question here in the chat that says, does the impact depend on industry affiliation? So I don't break down the occupation too much here. We do think about this hardship category, but we are currently trying to think more about specific occupations. So instead of lumping together just physically demanding jobs, thinking about things like, okay, where are these female workers seeing big effects, maybe in jobs like nursing, or is it rather in factory jobs? So we're doing some more work on that. I don't have it to show you today, but I think it's a really important question. Okay.
I had a question, rather than just industry, what about sort of regional effects? I just think of Austria, there's big differences in city size and so on. And I could see some areas, might be more rural, suburban, lower stress than others.
It's a good question. So we do have an indicator for our characteristics to know whether they're urban or rural. We don't have any sort of regional information because we don't actually know their employer or their their address. But we can say something about urban versus rural.
Because I was just thinking, if it's like in Vienna, which is could conceivably be sort of a really high stress, unhealthy area, that could be driving a lot of the effects compared to other parts of Austria.
Yeah, that's right. I wish we had effects for all of Austria. We just have Upper Austria, so we wouldn't have Vienna here. So this is going to be more similar because this is just one region, but we can definitely do an urban-rural split where we look at Linz versus other areas. Yeah, good point. So I've kind of showed you these shorter term effects, thinking about just what happens to health status right away, right after layoff. If you allow people to take an additional 9 weeks for their benefits. But now I want to think about if we were to expand that and think about what happens to an individual when they are deciding whether or not to retire, we can do some work looking at disability retirement claims. So as I mentioned earlier, in Austria, you can choose to claim disability, but this is going to serve as retirement. So unlike in the US, if you're, on disability, it might not necessarily mean you're also retired. This is going to be a substitute for early retirement in Austria. You can claim disability retirement if you are in pain or if you're disabled, but it does have to be certified by a medical professional. And what we're going to find here is that, interestingly, female workers are going to be less likely to eventually claim disability retirement once they're granted that additional 9 weeks of benefits, again, which could be driven by the fact that they end up on a different career trajectory or end up in a job with higher wages. Whereas we see the opposite for males. We see that they're about 8% more likely to claim. In magnitudes, these are going to be about equal to each other. About 500 fewer female workers are going to be less likely to claim, and male workers are going to be about 600 additional claims. So they're almost going to cancel each other out. And I think you can see it pretty clearly in this graph that prior to the age of 40, female and male workers are claiming at about the same rates. But once unemployed workers are laid off over the age of 40, when they're eligible for this addition in benefits, we see this complete divergence here, where you see a pretty stark reduction in the probability that a female worker will claim disability and a large increase in the probability that a male worker will claim disability. And looking at this, you might say, wow, that kind of looks somewhat like an age-based diff and diff graph. You have kind of like a, 2 lines that look similar on levels prior to this treatment age. And so if we wanted to literally do an event study where we have an age-based diff and diff and a two-way fixed effects model where our females are treated and our males are not, you can see that the probability of claiming disability retirement of females as compared to males goes down over these different age cohorts. So I think that's a pretty striking graph. So again, these effects are going to kind of offset each other in terms of the number of claims. However, if we think that male workers typically have higher wages, which we do see in our summary statistics, that this is still going to be a fairly costly policy rather than just, say, targeting that benefit extension towards female workers or in particular low income or workers with children. So to summarize all of these graphs that I've shown you in a short period of time, just to remind you what we find here, we find that allowing workers an additional 9 weeks of UI eligibility benefits reduces opioid prescriptions. It also reduces antidepressant prescriptions. These effects are driven by female workers. We don't pick up changes in hospitalizations for female workers, although we do see some spillovers for their children that are under the age of 6 years old. We don't find any prescription effects for male workers, but we do see an increase in cardiac events and heart medications for male workers granted this increase in UI duration. And then finally, over time, we see that there's a decrease in the probability that female workers will claim disability, but an increase in disability claims for male workers. Again, potentially driven by the fact that female workers that take additional time to search are more likely to find higher paying jobs, whereas male workers that spend over 100 days looking for a new job find jobs that are lower paying. Now you might be saying, I don't know still if I really buy these effects, and I don't have time to show you all of the robustness checks we did, but I will say that we do quite a bit in the paper to reassure ourselves and our readers that this does seem to be a plausible causal effect. So for example, we don't see these effects 3 months prior to job loss. We don't see existing discontinuities in the data. We don't see any of these effects pop out if we only include workers that don't meet the experience criterion, meaning that they're not eligible for this extension and benefits. These estimates still hold up over a range of bandwidths. So kind of as we were talking about earlier, even if we narrow in our bandwidth, we're using less data, we still get these discontinuities pop out and they're statistically significant. And even if we change the functional form, so we're not relying on a quadratic fit, we do still see the same effects across these different outcomes. So just to kind of wrap up here, if we wanted to ask, well, okay, now that you've given me all these effects, I don't really know how to tie it all up with a bow and say something about what this really means for policy or what this could mean for workers. So what I'm going to say here is that in terms of costs and benefits, what we see is that very few of these workers actually exhaust the full 9 weeks of benefits. Only about 2 to 3% are actually using benefits. So the administration and benefit costs actually seem fairly low. Really, we're just giving individuals the chance to not be as stressed out over this long term. But especially for female workers, the health benefits in terms of reductions in pain, in terms of reductions in antidepressant use and depression seem large. So if we care about worker well-being, if we care about targeting interventions, it does seem like there's a potential to have a more optimal UI benefit duration calculation. We do see these spillover effects on children. So if we think that there are going to be large external benefits as well, it might make sense to, again, better target or lengthen UI benefit duration. Now, the offsetting effect here is that we do see an increase in hospitalization costs for men. We see an increase in disability claims for male workers. And so it might tell us something about the potential trade-offs of extending UI benefit duration. However, I think that what we can say here is that there's pretty strong evidence that one of the mechanisms for driving this is that females are matching to higher paying jobs, to less physically demanding jobs. That's going to potentially lead to more tax revenue down the line. And so if we balance those trade-offs, this seems to be a net positive policy to lengthen UI duration. And also it could suggest how to more efficiently target these benefits, given that we find larger effects for workers with children and workers in low-skill occupations with less education. Now, of course, this is potentially tricky. I don't want any of you to walk away from this talk saying, look, women are less likely to use opioids when they're unemployed. Maybe that means working is bad for them. Certainly, I don't want that to be the takeaway. It's more the fact that if we could provide resources to mothers who become unemployed, to female workers who become unemployed, or low-income workers, that it could have these positive health benefits that have positive spillovers. And importantly, we could be thinking about the costs and benefits of UI typically don't consider health in the equation at all. So it's possible that benefits to UI, especially for female workers, are understated. So I think this paper has important implications for not only thinking about the optimal length of UI benefits, but also for whether countries should be expanding UI benefit duration during this pandemic. So I appreciate all the comments and clarifying questions I've gotten throughout. I'll stop here and we can continue the discussion further. Thanks so much.
Thank you. Any questions?
I've got a question if nobody else does. So one thing I noticed for sure for antidepressants, and maybe it was the case for opioids as well, is generally the overall use of those was noticeably higher for women than it was for men. For antidepressants, and I don't recall if that was the case for opioids as well, but one of the issues that raises to me was, I don't know if you can observe patterns of uses of these medications for women out of the labor force, who are completely out of the labor force. What are their patterns with age? You know, the point you raised, does labor force participation affect opioid use and so on? But if it's a general pattern that this high usage rate of these medications is higher for women than men, maybe that's true even if they're not in the labor force. It would be interesting to look at that sort of life cycle pattern for both women out of the labor force entirely. And I don't know if you know single or married. I know that issue came up before, but just comparing that usage pattern by gender, because it was noticeable to me that the much higher usage rates for women anyway.
Yeah, that's a great point. That is super fantastic. And we can absolutely do that. We can see health effects for individuals not in the labor force. And we can also look at antidepressant use for part-time versus full-time workers. So that is something we should absolutely add into the paper. And I will definitely proceed with that in future drafts. So thank you.
And actually, speaking of life cycle, could you compare the same women and men before and after? Like, do you have like data for a specific person before the law was passed, when they were, say, younger than 40, and then after 40? Can you compare what happened to their health, or is it just two different groups that you look at?
I want to say that this law is fairly old. So I think that the law is maybe 60s or 70s, and we don't have data that far back. We can track people over time. So we know, like, obviously before and after layoff, but I don't think we can exploit the policy timing here.
Okay. And this is like before and after, is it like, is it something that's like a short period of time, or do you feel like itself sort of continues to be the case? Is it like, especially on the mental side, is it like, just feeling better or worse for a short period of time, or this is something that's more persistent?
Yeah, so opioid effects are persistent. We see effects for children are persistent. And by persistent, I mean at least 2 years later, we still see the effects are lower than their counterfactual unemployed females. So yeah, in general, the only things that aren't very persistent are things like heart attacks and cardiac events for men. We see some uptick of that essentially a couple quarters later, but then there's more reversion to the mean for men. So really opioid, the big takeaways here are the opioid and the wage effects, and the effects for children we see are very persistent.
I mean, for the men, I would, and maybe someone mentioned this before, I would think that if you know that you can have 9 more weeks of unemployment benefits, then you should be less concerned, right? And so what kind of effect on, say, on heart attacks that should have? Isn't the opposite of what you found? I mean, I had some technical issues, and maybe I missed parts of the presentation, but isn't it supposed to be the other way around? That's what you found?
So generally, we would think that you should have positive effects on mental health and potentially stress when you give people longer benefits. But what other papers have showed, and even the literature on conditional cash transfers has shown, is that generally when you allow men or male workers in particular transfer while they're not working, it increases riskier behaviors. So things like smoking and drinking. And so we think that potentially part of the mechanism driving our cardiac events is an increase in unhealthier behaviors. That we're not seeing for female workers. Don't see other. Okay, sorry, go ahead.
Yeah, I'm asking other questions out there.
Actually, I have another question. If you don't, I was thinking back on this issue about why the cutoff would have been set at 40 for the extension of benefits. And it occurs to me the general logic would be that when you're an older worker, it's much harder for you to find another job, that it's easier for younger workers to find alternative employment and so on. Especially when you get into 50s and 60s and so on. So I was thinking that could be a factor, but I was wondering by gender whether there's differences in sort of labor market trajectories. So if you think of the idea of internal labor markets, men might be more likely to be in sort of an internal labor market where it's going to be much harder for them to find other work. If, at a later career stage, they are laid off than for women that might be in more sort of gig worker type settings. So I was just wondering about, and then this whole issue of sort of commitment to the labor market and retirement plans, and you have the disability factor. So I was just wondering about that whole set of issues.
Yeah, I think that's really important. And so right now we're trying to push a little bit harder on, for example, whether or not male and female workers switch industries. And so I think this is getting at your point a little bit, because it's saying that if female workers are gig workers, for example, we're going to see them switch industries much more often. And so maybe it's possible that the male workers who are seeing the declines in wages are those that aren't able to switch industries. So they're kind of maybe trapped in a sense into just taking a lower paying job that might be more stressful. And so you see that happening. So yeah, I think it's a valid point that older workers are going to have a hard time finding a new job. But we can do more with the career trajectories. I'm also interested in doing more about just regular retirement. So for example, do we see female workers just retire later, period, not just disability, but regular retirement? And so I think this gets at that point a little bit too.
One additional thing I want to add, I think I saw it yesterday. Because of the lockdown and the pandemic and people being home, there was some surge in the consumption of alcohol. So I'm wondering if that's also another, like, if you stay home and more depressed, then you want to feel better, but there are different ways to feel better. And so maybe this is also kind of playing a role somehow. I don't know if in a sample like yours that could be looked at, but that's something certainly is being discussed right now in the past 6-7 months.
Yeah, I read an article the other day that said that parents during the pandemic have increased alcohol consumption by 4 times that of other folks. So that was a pretty striking thing. So basically, we can't do too much with alcohol. We've tried to look at alcohol treatment, so those enrolling in essentially substance abuse or alcohol addiction treatment. We don't see consistent effects there, but certainly we could do a little bit more to talk about that anecdotally, to think about maybe if it's affecting a particular type of inpatient visit. So we could think about hospitalizations due to alcohol-related disease or overdose too.
Yes, another thing I've been thinking about is this. So it's one thing to give me the option to have 9 more weeks of unemployment benefits. It's another thing to actually use it. And I know that we talked about this. So if I can find a job and return to work after like 30 weeks instead of 39, then why would I guess the point is, why would I stay if I have a job and I'm really feeling bad at home? There got to be sort of, maybe not everyone thinking that way, but at least some might think that way. And so I'm trying to sort of understand if people can find a good paying job that pays more than employment benefits, why would they decide or choose to kind of stay on employment benefits? And I know that's free money basically, but you can be paid more and you don't need to feel stressed. So it sounds a little bit.
No, I agree with you. So obviously, if folks can find jobs right away, they are going to take them. But pretty much what the general consensus is these days is that, in the literature at least, is that if you allow people longer unemployment insurance benefits, they do spend longer on unemployment insurance. Now, of course, not everybody's going to spend longer on it. So I think this is getting back to your earlier point where we could do more work with the quartiles of who's spending a long time searching for a new job and who's not, and where are the health effects coming from in terms of those different groups. But yeah, I mean, of course, if someone can find a better job right away, that they're going to take it. We do see, though, that by giving people a longer opportunity to search, they do end up getting a higher paying job. So, and they do spend longer on unemployment. So your point is right. I get the incentives there, but we just see folks taking longer when they know they have longer.
I can see that.
Yeah, but it probably speaks to your point to the fact that only 2% of people are exhausting benefits, right? So it's not that everybody is taking that additional 9 weeks.
Well, one possibility is that, and I kind of mentioned that before, maybe they don't want to take the risk of going all the way to the 39 weeks. And so what they do, and I don't know, maybe they just get close to that 35, 37 weeks, so that at some point they have to go back to work because the 39 weeks will expire. And they sort of balance between maybe using more of the extra weeks, but not really getting to exactly the point where they have no job and no unemployment benefits anymore. And so maybe you want to look at just close to the 39.
Yeah, I think that's a good point. So I can literally envision the table now. I think that's something that, maybe we can do in the next couple of weeks to put it in the paper. I think that's a really important point. Anyone else have questions?
Any questions, comments? But I guess thank you very much for doing this. Pretty interesting, and yeah.